for about 15 minutes, and we cannot be very sure about when exactly she will be coming, because her time is valuable and we are so keen that she comes here. So we may have to disrupt in the middle to accommodate her for about 15 minutes, sometime around 11 o'clock in the morning. And 10:45 she will come. And Professor Mavalankar also has to leave. So what I suggest is that the keynote address may be delivered now by Professor Mavalankar, followed by a brief speech from Indra Mallo and Mr. Ashwin Kumar. So I request Professor Mavalankar to kindly deliver the keynote address.
Thanks very much to SK, Rao, Somen and all the organizers of this program to bring the program here. We had requested, we have this new campus, so we are very happy that all of you are seeing our new campus, enjoying its facility. So thanks for that. Let me also officially welcome all of you to the Indian Institute of Public Health, Gandhinagar. I'll spend about 1.5 minutes to introduce you to its activities. We have a short film of about 4 minutes. At any point in time we can show you that. Some of you know our institute, but for others who don't know, the history of public health, in some sense scientific public health, started with the British establishing the All India Institute of Hygiene and Public Health in Calcutta and the Institute of Tropical Medicine across the road on Chitraranjan Avenue. Some of you I know are from Calcutta, in fact, that's why I'm telling you the history a little bit. In late 20s, early 30s, it was thought that time public health as a multidisciplinary subject, where doctors, nurses, microbiologists, statisticians, sanitary engineers, social scientists, health educationists will work together to improve the social, behavioral as well as environmental conditions to improve the health of the society. And historically, Ronald Ross, who was a colonel in the British Army, worked there and in Secunderabad to find the mosquito which causes malaria, and for which he was awarded the Nobel Prize. So we have very proud history of public health. Unfortunately, as in many times in India, many things are forgotten. Public health was misunderstood and forgotten after independence and merged with medical colleges as a subject. So it became a subject for doctors, only training doctors and nobody else. So the multidisciplinarity was lost. To revive that, the Public Health Foundation, even WHO had recommended that India should start multidisciplinary public health schools. So Public Health Foundation was set up in 2006, which then went to state governments to see which state governments would be interested to set up institutes of public health, which are outside of a medical college. And Gujarat was the first state. Andhra Pradesh, Hyderabad, Orissa, Delhi and now in Shillong. So we have 5 institutes and the Central Foundation which work for last 10 years on various multidisciplinary ways of improving public health. Our institute started in 2008 in a small rented building and we moved last year here in this new campus. The land has been given generously by Gujarat government, 50 acres of land, to establish this institute and some part of the initial construction cost. In 2015, we convinced Gujarat government to pass a special act by which this institute was converted to the first public health university of India. We thought it was the first public health university of the world, focused public health university, not doing anything else. Of course, there are many other general universities doing public health. But then we found out that Myanmar had set up a public health university. So we are not the first in all of the world, but we are the first in India as an independent public health university. And since then we have started a 2-year Master of Public Health program, which is running in the 3rd year. We used to run a postgraduate diploma in public health management, which is in the 8th year. And this year onward we have started Master of Hospital Administration. So these are the 3 long-term programs. We also run a short 3-month program for occupational and industrial health, because that is also required under Factories Act to employ well-qualified industrial physicians. Besides that, we run some short-term and distance learning program. We have faculty of about 16 full-time people. Half of them have medical and public health background, and rest half of them have social science, economics, management, nutrition, statistics, etc., and many other public health related fields. Our faculty, Somen Saha, has been instrumental in working with your group and doing the state of practice report. The last one was 2014, which brought together the knowledge and evidence of how health can be layered on the microfinance initiatives and how that will benefit both the health sector as well as microfinance sector. Basically, all of you are deeply engaged in the microfinance on removing poverty or reducing poverty, and that is the various international goals, national goals. You see any document of any developing country and that is the right and front of it. Now, why health? In some sense, historically it was well known that health and poverty have very close connections. Ill health leads to poverty and poverty leads to ill health. It is estimated now that 6 crore people fall into poverty every year in India just because they fall sick and they cannot manage, and there is not enough social arrangements to manage their life when they are sick. Poverty, lack of education, lack of empowerment, social deprivation, natural disasters and shocks which are increasing with climate change all lead to ill health, malnutrition, and that leads to lesser working capacity and again sort of leads to the vicious cycle of poverty and ill health. Since independence, our governments have been sort of struggling to establish a well-functioning health system. Unfortunately, somehow as a nation, we haven't thought that health is a priority, and we have underinvested over the last 60 years in health, where only 1% or 1.2% of GDP goes, public money goes in health, whereas the private expenditure is almost 4% of GDP. And that has led to an infrastructure of health which is good in urban areas but poor and very poor in tribal and very difficult areas. Our main failure of the health system is not able to reach the last mile. And that is where your connect becomes very important, because